Hello everyone. Now we are going to discuss about a form of cell injury known as apoptosis. Literal meaning of apoptosis is falling off. By definition, cell death induced by tightly regulated suicidal program in which cell die via activation of intrinsic enzymes. This is also known as programmed cell death. This is seen in some of the pathological condition and physiological condition. Examples of physiological apoptosis are during development in embryogenesis, involution of hormone dependent tissue like endometrium and breast. Involution is decrease in size. Cell homeostasis in bone marrow. Elimination of self-reactive lymphocytes. Death of host cell that have served their useful purpose in inflammation, like neutrophils in acute inflammation. Whenever their purpose has been served, they has been eliminated by physiological apoptosis or apoptosis. Pathological apoptosis is seen in when the cell is injured beyond repair. Whenever there is DNA damage, accumulation of misfolded proteins, in viral infection, adenovirus, HIV, hepatitis, and in duct obstruction in some of the organs, which result to pathological atrophy in pancreas, kidney, parotid glands. Obstruction of the duct result into the apoptosis. So these are the examples of apoptosis in physiological as well as pathological condition. In morphology, in HNE, as we can see this rounded eosinophilic structure is an apoptotic body. So in morphology, there is typically shrinkage of the cell, condensation of the chromatin, which is the most characteristic feature of apoptosis, chromatin condensation, formation of cytoplasmic blebs and apoptotic bodies. Cell is converted into small apoptotic bodies. Phagocytosis of apoptotic cells or apoptotic bodies by the macrophages. Now we will see the mechanism of apoptosis. How does it work? There are typically though two main pathways we will discuss: mitochondrial pathway, or also known as an intrinsic pathway, or death receptor pathway, or extrinsic pathway. In mitochondrial pathway, whenever there is cell injury, decrease growth factor, or DNA damage by any reason, protein misfolding, this will result into the activation of BCL family sensor, which stimulate the BCL family effector, namely BAX and BAC. Then they stimulate mitochondria. Mitochondria releases some mitochondrial proteins named cytochrome C and other pro-apoptotic proteins. Then they react with bind with APAP1, apoptotic activating factor 1, and ultimately they activate the caspases. There are different types of caspases involved in intrinsic pathway and extrinsic pathway. For intrinsic pathway, caspase 9 get activated, and for the extrinsic pathway, caspase 8 or 10 get activated. These caspases then activate the executioner caspases, namely caspase 3, 6 and 7, and they activate various enzymes and result into the breakdown of the cell. In this diagrammatic representation, we can see there is activation of initiator caspases, then they stimulate executioner caspases which activate endonucleases and some other proteases. Ultimately, formation of the apoptotic bodies which has been phagocytosed by the macrophages. Now we will see the regulators of apoptosis. Regulators of apoptosis. In this category, first is anti-apoptotic proteins. Those who oppose the process of apoptosis, anti-apoptotic proteins. Mnemonics is 2XM. 2 is for BCL2, X for the BCLXL, and M for MCL1. These are known as, they are the part of BH124 family. BH is stand for BCL2 homologous. So in anti-apoptotic proteins there are three main proteins: BCL2, BCLXL and MCL1. They inhibit the apoptosis. Other category of regulators of apoptosis is pro-apoptotic proteins. They are VH1 to 3 family proteins. Examples of pro-apoptotic proteins are BEX and BEC. They are oligomers and they promote the apoptosis by releasing cytochrome C from the mitochondria. And the third category of regulators of apoptosis are regulators apoptosis initiator. They are BH3 only proteins. They can promote or inhibit the process of apoptosis as per the requirement. Examples of regulator apoptosis initiators are BIM, BID, BAD, PUMA and NOXA. These are the examples of regulators apoptosis initiator. So we have seen the three major categories of regulator of apoptosis: anti-apoptotic proteins, 2XM is the mnemonic for anti-apoptotic protein, BCL2, BCLXL, MCL1, pro-apoptotic proteins, BEX and BEC, regulator apoptosis initiator, VIM, BAD, BID, PUMA and NOXA. As we can see, in the normal viable cell, there is enough of survival signal or growth factors which stimulate the production of anti-apoptotic protein BCL2 or BCLXL, which prevent the leakage of cytochrome C, and there will be no apoptosis. In apoptosis, there is lack of survival signal or some exposure of cell to some injurious stimuli which result into the activation of BH3 only proteins. BH3 only protein, as we can see in regulator apoptosis initiator, they can promote or inhibit apoptosis as per the requirement. They antagonize BCL2, and this will result into the activation of Bexvec channel and promote the leakage of cytochrome C and other proteins, and result into the activation of caspases and ultimately in apoptosis. The cytochrome C releases from mitochondria. This will act or bind with APAP1 and synthesize apoptosome, which bind to caspase 9 or activate the caspase 9, which ultimately activate the execution caspases caspase 3, 6, 7, and result into the cell damage. There are a group of protein SMAC and diablo. They inhibit IAPs. IAPs stand for inhibitors of apoptotic proteins. So by this pathway they also stimulate the caspase 9 activation. Now we will see the extrinsic pathway or death receptor pathway. Death receptors are the member of TNF receptor family. TNF receptor 1 of FAS, also known as CD95. These FAS ligands are present on the T cells which react with the FAS receptors. FAD stand for FAS associated death domain. This react with the procaspase 8 and activate procaspase 8 into the active caspase 8, and active caspase 8 then stimulate or activate the executioner caspases caspase 3, 7, and ultimately result into the apoptosis. What are executioner pathway? By a mitochondrial or intrinsic pathway, caspase 9 get activated, and by death receptor pathway or extrinsic pathway, caspase 8 or 10 get activated. They stimulate or activate the executioner caspases, namely caspase 3, 6, and 7. After activation, executioner caspases inhibit the DNA, inhibit the inhibitors of DNase. So DNase got activated, and on the other hand they proteolyze the structural component of nuclear matrix. So ultimately result into the fragmentation of nuclei by activation of DNase or proteolyze structural component of the nuclear matrix. So this will result into the fragmentation of the nuclei. Now after the apoptosis, we will see how the cell removed from the body or from that local area, removal of the apoptotic cells. In the normal cell, phosphatidylserine is on the inner leaflet of the plasma membrane, but in apoptotic bodies there is a flip occurred, which result into the flip of phosphatidylserine from inner to outer surface of the plasma membrane, and these phosphatidylserine is recognized by the macrophages and result into the phagocytosis. This is basically known as eat me signal by flipping of the phosphatidylserine from inner to outer surface. Apoptotic cells secrete some soluble factors and they recruit the macrophages. This can also stimulate phagocytosis. And apoptotic cells have some cell receptors, antibodies, and C1q that recognized by the phagocytes or macrophages and result into the phagocytosis of the apoptotic cells or apoptotic bodies. There is a term known as efferocytosis, which is basically stand for the phagocytosis of apoptotic cells. Process of removal of cells in apoptosis is very effective, and that is why there is no inflammation in the local tissue, unlike necrosis where we see the local inflammation. Thank you.